is a postnatal mother, delivered yesterday, and her hemoglobin is 9.8 grams. Before discharge, it's always a good practice to correct the anemia, right? So we have calculated the hemoglobin based on the body weight. Ganson's formula is 2.4 into 40 kg. The deficit has come as 1.2, and for the stores we are giving 500 mg, and 615 is the calculated milligrams. So she requires 3 doses of iron sucrose to be given on alternate days. So now we are going to arrange IV parenteral iron sucrose for this mother before we discharge. The baseline, we'll have to check the pulse rate, the time of start of the iron sucrose, the saturation and the blood pressure. So it's always ideal to have a pulse oxy so that the monitoring can happen. And then this is the freshly prepared iron sucrose, 200 milligrams in 100 ml of normal saline. So 1 ampule, can you just show, Pragati? It's always a good practice to keep the anaphylaxis tray always ready by the side of the mother. For this we need 1 RL, the green intracath, IV set, and these are the important drugs to be used in case if she requires: hydrocortisone, Avil and adrenaline. The nurse has to check on the expiry dates and also make available spirit swabs and also the 2 cc syringes. So this is the anaphylaxis tray that has to be kept ready, and of course we have the central oxygen supply if at all it is required. It is always to be prepared freshly, never keep in advance, and 2 days prior we'll have to stop the oral iron so that the free iron in the circulation will be less, and then the reactions will be minimized if you stop the oral iron 2 days prior to the parenteral iron preparation. So now how do we give this? This is 100 ml. So we do not give any test dose. So the initial first 15 minutes we transfuse only 25 ml. So 25 ml has to be given over a period of 15 minutes. Then the rest of the drug, that is, how much will be left? 75 ml. The 75 ml has to be given in the next 15 minutes. That's how we are running the drip, and the monitoring is most important. So we'll have to have a close watch on the flow rate and also the end time. In this mother, we'll have to complete it by 12 noon. So the entire infusion has to be completed in 30 minutes. And again, how much more time after the infusion are you supposed to monitor the mother, Dr. Pragati? After we finish the infusion, you feel 2 hours. So at least 30 minutes after you complete the infusion, the mother should be under monitoring for another extra 30 minutes. So what are the likely side effects you think of? Fever, okay, chills, back pain, yes, urticaria, tightness of the chest, difficulty in breathing. The most dangerous severe kind of reaction would be like difficulty in breathing and fall in blood pressure. So any kind of reaction, the first thing the nurse has to do is to stop the infusion. Inform the doctor. Stop the infusion, inform the doctor so that we can start off the RL, and then we will decide depending on the type of reaction. For mild reaction, Avil would be sufficient. But for severe form of reactions, we'll have to give adrenaline intramuscular 1 ml and hydrocortisone. And also we'll have to monitor those mothers in the ICU. They may also require oxygen. Sometimes they go into cardiorespiratory effort, and all these reactions should be mentioned in the record. So, anything you want to add about iron sucrose?
It can also lead to AK in some cases.
Sorry?
It can also lead to AK in some cases.
AKI. See, it's all an anaphylactic reaction. Immediately there can be breathing problem. Most severe form would be the respiratory. So, laryngeal edema, difficulty in breathing, cardiorespiratory arrest. Those are the, whereas the chills, urticaria, they are said to be the minor ones. Okay. And then most important, when do you like to...
Tachycardia and some patients will set into...
Yes, but now I want to know from you, when do you like to start the oral iron after this 3 doses? So this mother requires 3 doses of iron sucrose. So when do you want to start?
After the last dose, for 4 weeks, for the start oral iron.
So you, after the last dose for 4 weeks you want. Why so long? So after the last dose, after 5 days you can start the oral iron. In the postpartum period, we need the hemoglobin to be corrected to what level? When do you define anemia in the postpartum period?
Less than 10.5.
So less than 10.5, you're right. So we aim for correction for at least 10.5 and above. For that we'll have to restart the oral iron 5 days after the last dose of iron sucrose. Thank you. So mentioning about the drip rate, so it is 200 mg of iron sucrose has been dissolved in 100 ml of normal saline. So the first 25 ml, the drip rate should go at the rate of 26 drops per minute, right? And the rest of it should go in the next 15 minutes, because the idea is to complete within 30 minutes. It's the whole of the infusion. So 25 drops and then 80 drops per minute. So a rough calculation has to be made so that this point W by V, this corresponds to roughly 20 ml, 25 ml. There's a mark over here, 20 ml. So this corresponds to 25 ml. Till this point, it would be like a test dose where the infusion rate will be 25 drops per minute. And from here to this end, the drip rate is 80 ml per minute, and it has to go fast. Thank you. Rate has been increased. We finish with the 25 ml. Now the column, we can see it has moved lower to this. Now we are going to complete it in another next 15 minutes. So now the drip rate has been increased.